but not this levy for a plan that increases urban sprawl and removes access to hospital services for thousands of Windsor residents in the core. We haven't had a public consultation on this yet, and that is a problem. My worry is that this project is more about development than improving our healthcare. The levy is only part of what Council should be considering tonight. You need solid analysis. You need to prepare Windsor for even higher taxes if this plan is approved by the province. After you voted on December 21st, Councillor Borderland tried to get support for a second motion to analyse the $250 million in additional infrastructure. The CAO said that night that the analysis wouldn't be available until about April or May, and so tonight we're talking about the same issue, but you don't have this report available yet. Councillor Elliott, in December you said it would be a relief for patients not to have to travel out of town for healthcare anymore. Well, this $2 billion proposal won't provide more OR time for to attract new physicians. It won't give us any more nurses. Patients will continue to travel for specialized treatment. Now, I know that county residents will save a couple of minutes, but this will be at the expense of our lowest income wards, and especially yours. And believe me, your constituents are really worried. Many of you were elected on a promise to stay the course on taxes. While there's a lot of anger about the proposed levy, the full brunt of it will only hit after people start really seeing the extra costs involved. Let's start with EMS. Port Colborne has a population of 18,000. In 2009, their hospital was converted to an urgent care, just like ours is proposed to be. Patients needing hospitalization or the ER were sent to St. Catherine's. This led to the need for 19 additional full-time staff and 2.4 more ambulances. How much will this cost in Windsor, a much bigger community with about 5 times as many residents living just in the core? Councillor Payne, in December you asked a question about EMS, and I listened very carefully to Mr. Mouget's answer. At no point did he refer to the financial impact, but you need this analysis in order to make a fact-based decision. In January, our group received a copy of a letter by Rick Spencer, who is the consulting engineer for actually both shortlisted sites. People can read this in its entirety on our site, which is at windsormegahospital.ca. And I followed it up with a visit to make sure that I understood the issues. Mr. Spencer said his cost estimates were changed without running them by him first. He said the hydro supply to the site is inadequate, even though it was a specific RFP requirement. It's really disturbing to me that the O'Keefe site scored 90% on servicing that just simply doesn't exist. As far as I can tell, this is a multi-million-dollar cost that will simply be downloaded to Windsor taxpayers. It goes against the spirit of the RFP. I emailed Krista Walkie from Stantec, Glenn Ackerley, the Fairness Advisor, as well as Tom Hunt for clarification, and nobody has had the courtesy of responding to me. Our group has also received a detailed open letter from Stephen Kapusta, a planner and transportation expert who worked for the city for 10 years. He explained why, in his opinion, the hospital proposal is in conflict with Windsor's official plan. He explains why the cost to extend transit to the O'Keefe site will be high and the service infrequent. But you need a financial impact analysis of the necessary transit service in order to make a fact-based decision. Windsor's policy is that growth pays for growth, and I understand that no development charges will be levied for this project. This means that Windsor will forego $10 million in DCs if it goes ahead. In other words, Windsor taxpayers will pay for even more urban sprawl. And this is exactly what the policy sets out to avoid in the first place. Of course, DCs will also be waived if the hospital is built in the core, but in that case, Windsor won't be on the hook for site servicing costs. So in conclusion, Council doesn't have the analysis to support a levy. There was no public consultation. In fact, the community hasn't heard from a single medical expert who is not on the hospital's payroll. You haven't looked at the financial impacts. A vote for a levy is putting the cart before the horse. Council, in my opinion, is in no position to support this levy tonight. Please don't make a decision that will come back to haunt us all.
Good evening, Philippa, and thank you for your presentation again. In your presentation, you talked about the West Side again, and I know we had this conversation the last time we were here. I believe what you stated was that the West Side is at a disadvantage. Can you help me out with that again, please? Why do you feel that? Why do you feel we're at a disadvantage? Is it, and I'm thinking I'm probably the wrong direction or something again, but are we at a disadvantage in terms of accessibility to the hospital is what you're driving at? Is that what it is?
It's a number of different factors. The West End is the lowest income area of all of Windsor's wards, so that's well documented in Stats Canada's figures, and actually the LIN has a section in one of its reports where it maps out the social deprivation, and it actually identifies the West End as the most, they call it the most socially deprived region in Essex County. But the way that the hospital impacts this is currently the closest hospital is Elliott campus. It's about 4.5 kilometers from the West End, depending on exactly where you live. And well, we know that that's going to be closed under the plan and converted to an outpatient facility. So it's good that it will help people with chronic disease. But if they have emergencies, they have two choices. They can go to the urgent care clinic at the Grace site, which will not be open 24 hours a day. It will be open between 14 and 18 hours. It's also not meant for very serious conditions. So on the Windsor Regional Hospital website and at other urgent cares, it's well documented what kind of conditions you would go to an urgent care for. So if you're having something like shortness of breath, you know, you might be having a stroke or a heart attack, or it might be something not so serious. You have to make a choice. So you're going to go to the urgent care center, maybe they'll help you out, or maybe it will be something that will require going to the hospital, which is then another 15 kilometers away. If you live on the other side of Huron Church, it's about 22 kilometers to the County Road 42 site. So again, going back to the poverty issues, and there's a lot of old people as well who don't drive. In fact, about over 10% of people living in the West End don't drive at all. It's going to be really difficult for them to get to the hospital, and if they have to take a cab, the return cab fare is between $70 and $80. So as some of the other people have explained, that's really unaffordable when you're on a very tight budget.
Philippa, how well do you know the West End? Or do you know it because of everything you just talked about is what you read about it? How well do you know the area? And the reason why I asked that question is because there are some low-income families, the social housing, but I think you, what you're reading, and I hope it's not your interpretation that the whole community is low-income, because I'll tell you something. There's 3 levels of economic in the community, you know, so that whole perspective about, you know, the poor West End or something, I think you're missing the whole community itself, because you could go over to where the Tayford campus is and see the community over there.
Well, I understand.
It's very far from low income. So my point is that we have the means to access the mega facility. Sure, there are some families that, you know, it's going to be an issue with it, and that's fine, but the whole community itself is not going to be faced with that issue. Like, it's almost like you're saying we can't go to, let's say, Lozon Road unless we take a cab or something. It's not true. You know, it's a very small percentage of social housing. I just wanted to clarify that. Anyways,
can I speak to
my next question, you yourself and some of the other delegates talk about urban sprawl. Explain what that is to me, because I keep hearing this term, and I think I know what it is, but let me hear what your definition is, and we'll go from there, please.
Well, urban sprawl is what happens over time. It's something that really started after the Second World War, where cities started migrating out. They started developing suburbs, and they migrated outwards, and people would live in those suburbs and typically drive to work. And so the planning, I'm not a planner, but the emphasis on the planning was not on close communities where everybody could walk or cycle. So active transportation wasn't considered to be an important way of getting around. And so now we have a city that is very, very spread out. The urban sprawl is something that you see typically in the county and our southern suburbs. So if you look anywhere south of EC Row, that to my mind would embody where we have urban sprawl in Windsor.
So could we consider that urban sprawl is the future? Can we say that? Can we say that? Question. Can we say that urban sprawl could be the future?
You could say that it's a feature, but it's a very negative one. There's no city, no forward-thinking, progressive city anywhere in the world that would want to advertise its urban sprawl. You would never, ever want to do that. And I think Mr. Hunt could confirm that.
Okay, and the reason why I say that too is because the future is coming. You can look as far as the new parkway and the bridge that's coming too. So this whole concept about, the mega houses is going to attract urban sprawl, I simply look at it like it's the future. The future's coming because it's already here.
That's not what the urban...
Okay. Well, I'm just saying that you have that opinion. I have this opinion. That's what I see urban sprawl is the future because it's coming. It's right here. And when the Gordie Howe Bridge gets built, that's another part of that. Call it whatever you want to call it.
Provincial planning statement that sets guidelines for efficient cities. And urban sprawl...
Philippa, thank you. That's it. I don't have any more questions. Thank you.
I have councillors, members of the audience, please.